If we stay connected during the next 45 minutes, I'll make everybody in the room a promise. I promise that you will pick up a couple tips, tools, and techniques to help you manage anticoagulated patients. And if you don't see some of these cases that we're going to go over this week, pay attention because you may see them in practice next week or next month. So this could be the most important 45 minutes of the whole conference. All right, let's start with a case. 66-year-old woman presents with a 4-day history of thigh and inner calf tenderness, no fever, chills, trauma, surgery, or recent travel. And when you examine her, you see this warm, tender cord from the just below the knee to the mid-thigh, tracing the direction of the greater saphenous vein. And so you've made the diagnosis of probable superficial phlebitis. So at this point in time, do you have to do anything more? And if so, what would you do? Check a D-dimer? Check a CT scan to make sure she doesn't have an occult malignancy? Go ahead and just don't do testing. Start treating her with a nonsteroidal and maybe a hot pack. Ultrasound of her lower extremity? Or maybe because it looks so inflammatory, check a white count and a blood culture before doing anything. What would you do? Okay, as Jamie told me, this is a very astute group, and the vast majority would get an ultrasound of the lower extremity. Let's talk about why we would do this, because if we go back and take a look at some of the early literature, superficial phlebitis was thought to be a very benign disease. And we just go ahead and we've all treated it different ways, different nonsteroidals or hot packs or the like. But an epidemiologic study published in 2010 looked at, it was a French study, they looked at 844 consecutive patients that had a superficial phlebitis at least 5 centimeters in length, and they ultrasounded everybody. And what they found was 25% had unexpected deep vein thrombosis at the time they presented with superficial vein thrombosis. Some of these people then, okay, so you treated the ones with deep vein, but the rest of the 75% were followed for 3 months. Some were given short courses of anticoagulation.